So, you're living with both asthma and COPD, and suddenly a flare-up hits. You're short of breath, you're wheezing, but you're thinking, what is actually going on here? Is my asthma acting up, or is this a COPD exacerbation? Getting that answer right is absolutely key to getting the right treatment. So, let's play detective for a little bit and figure out how to decode what your body is trying to tell you. So that's the big question, right? How in the world do you tell the difference? The good news is your body gives you clues. I know the symptoms can feel all jumbled up, but they really do leave a trail of evidence. And by the end of this, you're going to know exactly what to look for to help make sense of it all. Okay, before we dive into the clues, let's just quickly clear up a term you might have heard: asthma-COPD overlap. Now, as you can see here, the leading guidelines are really clear on this. This is not a single, separate disease. It's just a way to describe someone who has features of both conditions. Think of it like two different things happening in the same neighborhood. To solve this mystery, you really do have to think like a diagnostic detective. Your body is the scene of the crime, and your symptoms? Well, that's the evidence. We are going to investigate 4 key clues that will help you and your doctor figure out whether asthma or COPD is the main culprit here. All right, our very first clue is all about the clock. It's about timing. The pattern and the timeline of how your symptoms show up can tell a very, very specific story. Let's take a look at the classic timelines for both of them. The key difference here really is speed and consistency. With asthma, symptoms can feel like a total roller coaster. You might feel pretty good during the day, and then bam, you have a really rough night with wheezing and coughing. It can change hour by hour. A COPD exacerbation, on the other hand, that's usually more of a slow burn. It's this persistent decline over several days, where you just feel a little bit worse, a little more breathless each and every day. Every good mystery has its accomplices. In our case, these are the triggers that actually set the whole thing off. Figuring out what happened right before your symptoms flared up is our second major clue. And here you can see the completely different personalities of these two conditions. Asthma flare-ups, they're often linked to things like pollen, a dusty room, maybe a really big laugh, or a run in the cold air. But COPD exacerbations, they are very frequently kicked off by an infection. That cold that's been going around the office, or exposure to things like heavy smog or smoke. And hey, this isn't just a theory we came up with. This slide shows you exactly how healthcare professionals look at this. This comes from the official GOLD guidelines. That's the global standard for COPD care. You can see they do a really thorough assessment, and they're not just looking at symptoms. They are specifically hunting for those underlying triggers, like infections. All right, let's get to our third clue and see how this builds our case. This one is all about the physical evidence. We're talking about what's going on with the mucus or sputum you might be coughing up. And believe me, it can be a surprisingly powerful clue. With a typical asthma flare, mucus might not change much at all. But for COPD, oh, it's a huge clue. If you start to notice you're coughing up more stuff than usual, and it's changed color, maybe it's turning yellow or green or just getting thicker, that is a classic hallmark sign that a bacterial infection is driving your COPD exacerbation. And that is absolutely critical information for your doctor. And this isn't just a hunch. Just take a look at this. This is a direct quote from the latest GOLD report. A 94.4% sensitivity. That's an incredibly high number in medicine. It basically means that if there's a significant bacterial infection brewing down in your lungs, there's a very, very strong chance you're going to see that change in your sputum. It's one of the most reliable pieces of evidence you've got. Okay, on to our final clue, and this one is a real time test. It's all about what happens when you intervene. How your body responds to your rescue or your reliever inhaler can tell you a whole lot about the underlying problem. Think of it like this. With an asthma attack, the main problem is that the muscles around your airways tighten up, like a cramp. Your reliever inhaler is designed to relax those muscles, and that's why you often feel a really fast, pretty dramatic improvement. But with a COPD flare-up, there's more going on. You've got inflammation and mucus plugging things up. So while a reliever might help a little, the relief is often only partial because it doesn't solve those other issues. So we've looked at 4 clues. But what happens when the case isn't so clear-cut? What if you have a little bit of evidence pointing to asthma and some pointing to COPD? This is a really common scenario, and it can be super confusing. Well, when there is any uncertainty, the official guidelines from big organizations like GOLD for COPD and GINA for asthma, they're all on the same page. They take a very clear safety-first approach to protect you from the most serious potential outcome. And here it is, the bottom line, straight from the source. Essentially, if your doctor even suspects asthma could be part of the picture, the treatment should follow the asthma guidelines. So what does that really mean? It means when in doubt, treat for asthma first. But why is that? The reason is simple, and it's all about safety. Undertreating the powerful inflammation that comes with asthma can be really dangerous, and it could lead to a severe, even life-threatening attack. Inhaled corticosteroids, or ICS, are the absolute cornerstone of controlling that inflammation. So that treat as asthma first rule just makes sure that this critical base is always covered. Okay, we've gathered all the evidence. Now the final step isn't to make a diagnosis all by yourself. It's about using your awesome detective work to have a much more productive, effective conversation with your doctor. So think of this as your clue report for your healthcare team. Just being able to answer these 4 questions, based on everything we've talked about, gives your doctor a really high-quality, detailed picture of what's been happening. It helps them make the absolute best diagnosis and treatment plan for you. And of course, just remember that being a good detective is all about gathering clues for the expert. And in this case, that's your doctor. This information is designed to help you have a better conversation, but it is absolutely not a substitute for professional medical advice. And one last, incredibly important point. Severe breathing difficulty isn't always about asthma or COPD. It can actually be a sign of other really serious emergencies that can mimic a flare-up. So if you are ever experiencing severe shortness of breath or sudden chest pain, please do not wait. Seek immediate medical attention. So we'll leave you with this thought. The goal here isn't just to solve the mystery of one single flare-up. It's about empowering you with knowledge. Because by learning to be an expert observer of your own symptoms, you really shift your role from just being a patient to being an essential, active partner in managing your own health journey.